Hypertension is the leading modifiable risk factor for cardiovascular disease and is the most common chronic condition. According to WHO, about 1.28 billion people are affected worldwide, and the most affected are those in the low-income countries. Hi, my name is Dr. Nuru Hassan, a medical officer at Bliss Healthcare, and today we're going to talk about hypertension. So the definition of hypertension, it is defined in layman terms as elevated blood pressure in the blood vessel. And according to the International Society of Hypertension, it is defined as to be systolic blood pressure of above 140 and diastolic blood pressure of above 90. So I think most of you are asking yourself, what is Daktari talking about, systolic and diastolic? So when you go to the clinic, when they measure, you get a digit that is above and a one below. So the one that's above, the numerator, that's the systolic, and the one that's below, the denominator, that's the diastolic. So in Kenya, we tell our patients, according to the International Society of Hypertension, we do not want the systolic to be above 140 and the diastolic to be above 90. So anything below 140, 90 up to 130 and 80, that's the acceptable BP range for our patients. Most patients, they do not show any symptoms. A patient just walks in and then you check the BP reading and you find it's high, it is above 140 and 90. So that's why we advise for regular BP checkups. Just pass by once in a while and take your BP so that you know, am I in the acceptable ranges or is mine the asymptomatic one? That is, I do not have any symptoms and yet my BP is still high. In some cases where they tend to have symptoms, they will present with symptoms such as headache, they present with dizziness, it could be chest pain. Some, they say, Daktari, nasikia heartbeat iko fast, that is palpitations. Others present with anxiety, confusion. Like those are in cases that they tend to have very, very high blood pressure, they tend to present with those symptoms. So we had said earlier on that most the patients do not have symptoms, but in the few that present with symptoms, when they visit us at the clinic or at the health facility, when we take their vitals, that is, it includes a blood pressure reading, they tend to be high, above 140, 90. In most cases, they tend to be above 140, 90, and the patient is asymptomatic, they do not show any symptoms. But in those that they show symptoms, when you check the blood pressure measurement and you find it is above 160, 100, that is a hypertensive crisis. So a hypertensive crisis can be classified into two, either a hypertensive urgency or hypertensive emergency.